Good evening, everybody, the chairman, and all the participants. I want to thank the organizers for giving me this opportunity to present my papers. I also want to acknowledge all the authors, including my colleagues, my surgeons, Dr. Bode Falashe and Dr. Sanusi Michael in absentia. Please go to the next slide. Congenital heart disease contributes significantly to health burden of children in Nigeria as part of West Africa. In 2008, Okoroma documented 1.02%, that is 1 in every 100 patients that presented to the Lagos University Teaching Hospital. Earlier, about 24 years earlier, Antia had documented 14.2% in a study of necropsy of 260 children. Transcatheter closure of congenital heart disease actually started in 1967 by Portsman, a German. Unfortunately, that was not possible in Nigeria until the year 2010. The study aimed to highlight the profiles of the patients that had had the procedure done, 12 altogether in a private setup, and to highlight the challenges that we have encountered in getting this done. It was a prospective study and cross-sectional carried out in a private setup, though it was a private-public setup over 2 years. They all had the congenital heart disease confirmed by echocardiography. Ethical clearance was sought for the documentation, and they were classified according to their social class. The data was subsequently analyzed. Altogether, we had 12 patients. All were referred to the center. 75% from a public setup and 25% from a private setup. The age range between 3 to 62 years with a mean of 13.5. 25% were male and 75% were females. All had acyanotic congenital heart disease. 10 had patent ductus arteriosus and 2 had secundum atrial septal defect. The first table highlights the profile of the patient in terms of the age, the sex, the diagnosis, their social class, and the mode of sponsorship. And from the table, which is continued in the next chart, only one of the patients was able to pay for the procedure. The rest were either sponsored by the government or non-governmental organization. In the second table, that highlighted the age at diagnosis and age at which they subsequently had the intervention done. The least was 2.5 years in terms of waiting time. Now highlighting on the challenges so far, it is obvious that we had very few number of cases, 12 over a period of 2 years. The mean age was very high. For the patent ductus arteriosus, it was 6 years, and for the secundum atrial septal defect, it was a lot higher, about 48 years. The mode of sponsorship from this study, only one was able to pay, further highlighting the fact that cost is an issue, both for surgical intervention and interventional procedure. In terms of the outcome of the procedure, all were successful. All the 12 were successful without any complications, and follow-up of all those patients, they're still doing fine, no problem whatsoever. Before now, as at the time the study was done, we had only one functioning cardiac catheterization cath lab in our country. But now we have 2 others that have joined, though one functioning. So partially we have about 1.5 or 2 altogether. Very few number of trained manpower. In terms of intervention, only one center as at that time, though another center has joined now, 2 altogether in a population of more around 140 million altogether. Cost is still an issue, and I think that is while the number of cases are still very, very few. In terms of recommendation, it is recommended that we have more functioning cardiac catheterization laboratory because the patients are there so that we'll be able to help many more. And I'm happy to know that many more countries have functioning cardiac catheterization laboratory in the region, and so many more can be done. There's a need for training and retraining of manpower, and we can actually refer and partner together in progress. There's a need for local manufacturing and sale of consumables, as it's been highlighted earlier. Most of the time, patients have to wait until we're able to source for this thing outside our region. I want to appeal and emphasize on collaboration, 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 because that is the only way we can move forward. Thank you.